Hey friends, we're back on another episode of Navigating Endo with Ashley. I'm getting a lot more comfortable with you guys, so I hope you guys are getting a lot more comfortable with me. And speaking of getting comfortable, make sure you get comfortable in your seat for episode 6. Hey guys, I'm so excited to have you back with me today. On today's episode, I really just want to help you guys understand my adenomyosis journey so far. And in case you're just looking for specific answers, I'm going to break this video down into 3 parts. One part is going to be about symptoms specifically that I've experienced related to adenomyosis. I'm going to have another part on how I was diagnosed and my actual experience and like what it felt like to go through that experience, like pain-wise. And then lastly, I'm just going to break down what took place in the 5 years between my endometriosis diagnosis and my adenomyosis diagnosis, just in case it helps to help you out in case you're going through this right now, and maybe my story will sound very familiar to you as well. So I'm going to break this down, and to make it easier for you to just slide through in case you want to get to one specific point. All right, so first and foremost, symptoms that I experienced leading up to my adenomyosis diagnosis, which again, I just want to reiterate that I didn't know about adenomyosis until I was diagnosed in 2020. So like I've said previously, I was diagnosed with endometriosis in 2015. Please excuse the emergency vehicles. They're right across the street, so it might happen a few times. So the 3 symptoms that I experienced were abnormal and prolonged bleeding with blood clots. So I'm sorry if that's TMI, but that's the reality of the situation. And my second biggest symptom was severe pain. And along with that was like severe pain when I was also having intercourse, which is a big deal because sometimes people think, oh, that's normal. But you should know and your body well enough to know whether it's normal or if it's just way too much pain. So for me, painful intercourse felt like my organs were just sitting too low and that they were being attacked, or having a menstrual cycle or period and just being in the craziest amount of pain, regardless of being on medication that was supposed to help all of that subside. How I was diagnosed with adenomyosis. So how I was diagnosed was my doctor was doing the typical investigating to try and figure out what was going on. And as part of that process, I was sent to get a transvaginal ultrasound done. Now, what it is you have to go in for your appointment and they look at you internally instead of just externally. Like a lot of people are familiar with ultrasounds with the jelly on your belly or abdomen or pelvic region, and then they use this wand over top and they look at what's going on inside. And that happens for me as well when I get a transvaginal ultrasound done. But they also use, for lack of a better term, because I'm not a medical person, like a probe or a wand that's lubricated, and then they gently insert it inside the vagina and they move it around. Now you may be asking, does this hurt? For me, yes. For me, it's very uncomfortable. It causes a lot of pain, and they oftentimes have to tell me to relax my muscles because everything just clenches up the second that they insert the wand. However, they are in my experience, been very graceful about it and understanding. So if you go through this and you feel uncomfortable, please tell somebody. There is a difference between someone treating you correctly and not. So always make sure that you speak up for yourself if you don't feel comfortable. And also just keep in mind, if you have a male technician, you do have the right to have a female person present for the procedure as well. I almost forgot to mention, and it's very important, is you have to drink enough water to fill up your bladder 1 hour before the procedure happens. So just keep that in mind, especially if you have to travel to the location, like if it's not walking distance and you have to have the transit time to get there. That also makes it very uncomfortable as well, because if you already have pelvic pain and then you're filling up your bladder with liquid and then you have to get there, there's so many things that could happen between those two time periods from the time you leave home to the time till you get to your appointment. So a couple of things that I always do is I always wear a liner, first of all, and I also bring a liner for later on in case the transvaginal procedure causes maybe like discharge or spotting. I don't know if that's the case for everyone, but that is the case for me. So I always keep those things as well. And I also like to bring some cleansing wipes just because it just makes me feel a little better after the procedure has taken place. Okay, and lastly is, what did I do between the 5 years of being diagnosed with endometriosis to my diagnosis of adenomyosis? Well, to be honest with you, a lot happened in those 5 years. I changed family doctors because I had a family doctor who was not treating me well as a patient. With going through the changes in the medications that I was taking, I went through a very depressing time, I'll say, on one of my medications. And it was to the point where I knew I needed to talk to somebody, just anyone, like a therapist or a psychotherapist or whatever the case may be. And I went to my family doctor and she said, just deal with it. And I asked her for a referral to someone and she said, no, you'll be fine. And I knew I wasn't fine. So I was advocating for myself and I found myself another family doctor. And I will leave a link in the description, of course, as I always do, for how you can find a family doctor for yourself if you are here in Ontario. And secondly, some of the medications that I was taking in that time period. So I was tried on different types of birth controls. They tried to do them back to back to see if they could stop my cycle, and that was never successful. I was tried on various types of progestins, which are, I'm not sure if I'm pronouncing that properly, but they act like progesterone to help regulate your menstrual or your reproductive cycle. I was trialed on estradiols, different forms. So I took the gel on inside of my legs and that left rashes. If I can find a picture, I will share that with you. I also took Estradot, which was a patch, a little patch, like a little square patch that I put right on my my bikini line, and that also left a rash, unfortunately. And I also tried IUDs, and which were extremely painful going in and coming out. So just keep that in mind if you are if you do have pelvic pain and you're considering getting an IUD in. And then I also have been on Lupron for a very long time, and whenever you're on Lupron, you have to have add-back hormones. Add-back hormones are so important when you're taking Lupron because they help to protect you from the dangerous side effects that Lupron can cause. Some are as severe as like osteoporosis, and there's a whole list of side effects, but just make sure that if you get prescribed Lupron that you at least have a conversation with your doctor or specialist about add-back hormones. And I've taken various types of add-back hormones with my Lupron depot shot over the years, because it's been years. And sometimes they're just one or the other, and sometimes they're like a combination of different types of hormones. And your doctor, your pharmacist can definitely help to describe what those mean for you. So don't forget to like, subscribe, and share, and connect with me on Instagram at my Endo Adeno World.